Let's bring him in. Our good friend, Dr. Joe Congini, Sports Medicine Center at Akron Children's Hospital. So, Dr. Joe, what do you have for us today?
Hey, Ray, I want to talk about something that just we can't get away from. We hear about it all the time, and more recently here as, we learn a lot from the college and the pro athletes as to what goes on in sports medicine, and we try to apply it to our high school kids and kids that we see down at our Pediatric Sports Medicine Center at Akron Children's Hospital. And that, right now this week, is the discussion of the tightrope surgery. And I think, with the tightrope surgery, we talked back in 2018 and 2019 when this surgery first came out to treat high ankle sprains, to get people playing sooner. And the key person we were talking about then, as we were coming down the stretch of the college football season, was Tua Tagovailoa. And he had that surgery done, really good success on one side, played in the championship game. The other side, maybe not quite as good, but we followed those through. And now I want to kind of give an update today. I mean, there are so many of these professional athletes, particularly football players and college football players. Last month, Brock Bowers, the All-American tight end from Georgia, had it done in October. He was back playing in a couple games this past week. And, of course, Monday, Kenny Pickett, the quarterback for the Pittsburgh Steelers, went almost immediately into the surgical suite after Sunday's game to have the tightrope surgery done. So remember, the tightrope is a surgery that uses a wire that when it's tensioned and positioned correctly, it kind of brings that ankle joint together. High sprains is when you tear that tough, taut ligament between the two lower leg bones, the tibia and fibula, above the bumps on the side of the ankle known as the malleoli. When they get these high ankle sprains, very painful, takes a lot longer to heal than the typical ankle sprain. So Kenny Pickett on Monday, Aaron Donald, Cooper Kupp, Ryan Tannehill, the number goes on and on of so many people have now had the tightrope surgery done. And then almost, the coach of the Steelers, Mike Tomlin, almost like a commercial this week is in his interview about how it speeds up the healing process, and we wanted to enhance the healing is the word, and that's what the people who came up with this technique, both the surgeons and the company that came up with the tightrope. One of the things that's a little bit newer to me and knowing about is that there's other joints that are using this technology on the tightrope, Ray. The AC, the separated shoulders, are now getting fixed sometimes with the tightrope. The Liz Frank, that's that foot injury where people are out for 8 to 12 months with a big surgery on their foot because they have torn ligaments. They're using the tightrope in the Liz Frank foot injuries. And there's even an FDA indication now for pediatric ACL. So it purports, the discussion is that it gives better alignment, no screws anymore, the screw fixation, so no second surgery to take screws out. Earlier weight bearing, better range of motion in these ankles. And so with all that, sounds like something that people would look at doing. But we know we're battling against normal natural history, is that in most of these kids in our office, they're going to get better with physical therapy. And it's really hard to know when they're not going to get better with just regular rest and rehab, and that we go that next step to a surgery. A surgery is a big deal on a kid, so we have to really think hard about making these decisions. It's not just all those pro athletes I named either, and high college athletes. It's so in the high school athletes in soccer, basketball, lacrosse, football. And so we do see it a lot, making those decisions about would somebody as a high school kid really need to have that surgery done where the wire is placed and tensioned in their ankle to speed up the healing. It's not an easy decision. So we look back at how it's going now. It's been 5 or 6 years. It's been high profile. Of course, when you read a lot of the studies, they're variable, and it's a little hard to know, but the people who do it a lot are saying what a great godsend it's been for athletes. So the other thing, though, you have to take into account is you have to be careful. There's complications in young athletes. surgical risks of bleeding or blood clots or infection. And do you want to make kids go through that when really, if they really worked very hard on their physical therapy and rested a little bit longer, they might end up at the same point anyway? And so you see the other side of it even in the professional athletes. Trevor Lawrence was hurt Monday night in Monday Night Football, right? High ankle sprain. And as of yesterday, he's still saying that he's going to go the rehab route and the boot, and he thinks that he can rehabilitate himself and get back there quickly. So we have to kind of balance these things. We have to look and see what the literature shows. What do they look like in 3 years and 6 years and issues like that? What's the outcome? What's the risk? And, is it?
Uh-oh. We may have lost him. Well, Dr. Joe Congini with us, Sports Medicine Center at Akron Children's Hospital. I like what he had to say there about that surgery. It's not everybody that's going to get it done. They don't want to do it on everyone, especially when you're looking at the young high school athletes. Dr. Congini looking at the high ankle sprain and the latest in surgery called the tightrope.